All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. These exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Welcome, everyone, back to the GynoCast. It's so nice to be here again with you, Twila.
Thank you, Dr. E. How are you doing today?
Very good. And for those of you who are new to the podcast, my name is Dr. Eric Heegaard. I'm a gynecologist. And Twila,
Yes?
what are you exactly?
Oh, I'm just the loudmouth lady with opinions.
You are the guy on the street.
Oh, I gotta be the
gal.
guy on the street.
The gal on the
Can I be
street.
I want to be the girl on the street.
You're on the
Or
girl
the
on
woman.
the
I'm
street.
going to be the woman.
Woman on the street.
Okay, I'm good on that. Oh, actually, that didn't sound good either.
Well, okay.
If you really
so-
think about it, that didn't sound good either. Can I just stick with being the loudmouth with opinions? I'm okay with that.
All right. Maybe we should have a T-shirt that says that.
Okay.
I like
I'll
that.
sell it.
I like that.
Okay.
I like that. So we are going to talk about something that is actually, it's very important, and it's something that we all know about, but probably don't talk about enough, and that is sexually transmitted infections. And it's actually something that we've had an increase in recent years, and you would think that with all the research and public information going out there that this would actually be going down, but in fact it is not. And in 2015, the CDC reported that there was the second year in a row that the 3 most likely sexually transmitted infections had gone up in the United States. And this is a big deal, and there's actually approximately every year about 20 million new infections.
That's a lot.
In terms of sexually transmitted infections. It is a lot.
Yeah.
And on top of that, when you actually look at the prevalence, which is the number of people who actually are already infected with the sexually transmitted infection, on top of new infections, you're talking about 100 million people in the United States who have a sexually transmitted infection now. And so let me ask you this. What is the population of the country, Twila?
Don't ask me to do math.
Well, it's
this late in the
300
day.
and something million people.
It's a lot.
So we're talking about a lot of people with sexually transmitted infections, and many people don't know they've got them. So I'm not trying to make anybody I'm not trying to panic anybody here.
Panic already set in. I can only imagine our listeners at home as like some lovely single woman who's listening, who's just, getting out in the dating world, and you just said 100 million people have sexually transmitted diseases.
Listen, I'm just reporting. I was a little astonished by that too, but fortunately or unfortunately, some people have more than one. So, they can.
Well, then I feel like this show is even more important because I think people should know.
That's right. What are your alternatives, Twila? You can sit on the couch. You can wrap yourself up with, cellophane.
Yeah.
Or you can interact and be educated and know what you're getting into.
Oh, I was going to go for option C, which was buy your vibrators and go on about your business.
Well, as we talked about in one of our other episodes, you got to be careful with the vibrators too. You got to clean them off.
Properly, yes.
Properly.
We're not. That's for another show, but definitely, dish soap is not for your sex toys. Don't do that.
That's right. So
yeah.
These are the things that you learn on the GynoCast that you need to know.
Absolutely.
So we have a guest today, Dr. Kelly Stecker from OB/GYN West. She's a board certifiable gynecologist. Thank you for joining us, Dr. Stecker.
Well, thank you for having me.
So Dr. Stecker is one of our newer gynecologists here at OB/GYN West, and she's one of our brightest bulbs in our box, in our little box. And you have actually had quite a bit of information, kind of cutting-edge information on sexually transmitted infections, and so you're our go-to lady.
I guess that's a good thing.
That's a good thing. So what I want to do is focus on, there's actually quite a few there's about 8 or perhaps even more kind of more common sexually transmitted infections, but many of these we don't need to talk about. I want to focus mostly on the most prevalent ones and give people the information they need to, well, try to be safe, to protect themselves, and to know when to come in and ask for help. And so we're going to talk about that today. I'm going to put Dr. Stecker on under the microscope, so to speak, and I'm going to tap into her brain.
Can I ask a question before we even get started?
Before we start tapping?
Yeah.
Okay.
Just from the layperson's perspective, what is considered a sexually transmitted disease?
Not pregnancy.
Okay.
Well, but kind of it is.
That's a sexually transmitted condition.
I mean, a little bit.
Well, that's a good question. And so what, doctor, let's throw this out.
So unfortunately, the sexually transmitted diseases are really anything that you can get sexually. They can be viral, they can be bacterial. So today we'll be talking about chlamydia and gonorrhea and trichomonas and herpes, which is more on the viral family. And we'll also be talking about human papillomavirus. That's
right. And the thing is that why do we care? I know this seems like kind of an obvious question, but, we don't worry so much about people who have an ear infection, doing a whole show on that, although we may have to do that on ear infections at some point, but it's not one of those things that
I know we were all making that face.
Probably not.
This is not a visual medium, but literally,
right. So
the two of us, there's two girls that said, "Wait, ear infections?
Well, if you've got them,
we'll pass on
a
that.
big deal. But
maybe.
there are many conditions that people have where that people are not losing sleep about it. But these are things that do. And so, why do we care? Well, number one, they're uncomfortable for many people. Yes. Although we will find that in many of these infections, people don't know about. But even beyond discomfort, there is the fact that they can have repercussions in terms of a person's long-term health
and reproduction.
And reproduction especially. So why don't we start kind of the more prevalent ones are gonorrhea and chlamydia that most people have heard about. Let's talk a little bit about that. And so, I think we're going to try to organize our thoughts a little bit by describing the condition, the infection. What is the presentation? Meaning, what are the symptoms that people may have, and how people can protect themselves, and how it's treated. So let's talk. Why don't we start with chlamydia? Because chlamydia is one of the more common infections. And let me just say, this is actually just before I let you talk, Doctor.
Okay.
I'm getting excited.
So this is actually something from the Minneapolis. So if our local newspaper. So if you are one of our Minneapolites here, this is from our local newspaper from yesterday. Right? We were all excited about that. The pregnancy rate in Minnesota has dropped almost 70% since 1990 among teens and young adults. However, chlamydia has gone up 15% since 2010. And so, and this is something that is a big deal. And
it's a big bump.
It's a big bump.
Yeah.
And so why don't you talk about what are some of the symptoms that people may have of chlamydia, and what is chlamydia?
Well, first, let's just kind of go back to what you were talking about with the bump and the chlamydia. So I think that one of the theoretical reasons why we're seeing the bump in STDs but decreased pregnancy rates is basically the long-term birth control that we have. And we're starting to use the IUDs in the next one on more. Yep. And so people are forgetting that they actually don't prevent sexually transmitted diseases. So I think it's important for people listening to know that just because you're covered for birth control does not mean you're covered for sexually transmitted diseases.
That's
so I
important.
think that's probably one of the biggest reasons we see the increase in teenagers, because they feel free of pregnancy so they don't have to worry about the diseases.
That's right. Well, so, it's one of the flip side of the same coin. It's wonderful that we're dropping on unintended pregnancy rates, but people are forgetting that condoms do more than just protect against pregnancy. So chlamydia, what are some of the signs and symptoms of chlamydia?
So it's important to know that chlamydia can affect both men and women. And so some people think that these STDs only affect one. So just kind of important to keep that in mind. But a lot of people will come in with a vaginal discharge, okay? Or they may have no symptoms at all, or they may come in with pelvic pain. So those are kind of some of the things that we see in the office.
Right. So, one of the things you mentioned that I think is very interesting is that you said that a number of people many women don't have any symptoms at all, which is why the recommendation is that we screen pretty much all women who are, is it 25 years or less?
Yes, 25 or less, yep.
And so, as a woman, it's important to advocate for yourself, and to not get agitated when we suggest that we ought to test for these infections. Because just because you don't have any symptoms doesn't mean it's not important.
And we're certainly not trying to offend people by asking if you desire these STD testing either. Because even, in committed relationships, sometimes things happen, and we just want to make sure that you're staying healthy.
Well, I actually think that's a really important point. I had my annual exam just recently, and it was they asked a battery of questions, and I am in a long-term committed relationship, and they did ask me, do you want to be tested for STDs today? And I always say yes, because I figure you get tested for everything anyway, and my insurance covers it. But that was a very interesting thought in my head, that they thought to ask it of me, and that I didn't react in a way that was like, I feel like I surprised the nurse when I was like, yeah, sure. And, but I think that's one of those things sort of and I'm always saying as the sort of customer, in these situations, you do have to be a little bit more thoughtful about that. And if you're having an exam and it's covered by your insurance and it's not costing you extra money, and you have what you need to be able to have a full health screening, get a full health screening. I don't think there's anything offensive about it. And understanding that even being willing to ask the question, if you asked me, do I want to have a test today? Me asking you, why would I need that test is just as a valid a response as, no or yes. Ask the questions and get your mind put at ease, so that you know what's being done, why it's being done. And I would say better to have an answer definitively than an I'm not sure, or I'm pretty sure, or nah, that probably couldn't happen to me. Get an answer.
That's right.
Well, and anyone with a new partner definitely should be screened. So, absolutely.
Well, and the other thing I was going to ask you, Dr. Stecker, is that you can have these infections for a long time and not know about it.
Unfortunately, yes.
And so just the fact that, you were tested 10 years ago doesn't necessarily mean you shouldn't, just because you're free then and you're not having symptoms, doesn't mean you shouldn't be tested anew.
That is true.
Correct? And so how do we test for chlamydia?
So a couple different options. So you can leave a urine sample in the office, or you can have a pelvic exam where we do basically a culture for this.
And so and the treatment for it is?
Well, the treatment is antibiotics. So, and thankfully, azithromycin is a very common medication, and most people do very well with it, and they can have that.
And so this is a pill that people take. This doesn't require, I just want to reassure people, it doesn't require getting a big needle stuck into your spine, correct?
That is true.
And so,
that would be a little dramatic.
I don't know about me, but I don't like pain, and so, I want to get the information I need to protect myself, but I'd be much more reassured if I knew that the treatment wasn't going to be something that was unpleasant.
Yeah, but I don't think any of us were thinking it's going to be a big needle in your spine. No.
Until right now.
Yeah.
Now we're worried that there's something out there that I need a spinal needle for.
That's the first thing that crosses. Whenever I see my doctor, I'm like, if I test positive for this, am I going to have a big needle in my spine? First thing I want to know.
Really?
Yeah.
I'm glad I'm not your doctor.
You're such a guy.
You should be. You should be.
I'll stick to women.
I know us girls go through so much as it is. Like that feels like the least amount of what could happen. I mean, I've actually put a person whose head was the side of a watermelon through my body. That's
exactly.
Well, I suppose that puts it all in perspective.
It really does. Yeah.
So the point is that it's easily treated. It's easily
treated.
Yes, it is.
But I want to emphasize again is that chlamydia, many women don't have any symptoms and their partners don't have symptoms, and it can cause a lot of damage, correct?
That is correct.
And it can really damage a woman's fallopian tubes and cause problems with future fertility. So it's important.
And we worry about ectopic pregnancies with that.
Tubal pregnancies, exactly. So if you scar the fallopian tubes and you get pregnant, we have to worry about that the pregnancy may not implant into the uterus. Now, how about gonorrhea? We oftentimes, it's kind of all in the same, we kind of lump gonorrhea and chlamydia together, although gonorrhea is not as common as chlamydia.
That is true. If you look at the 2015 cases of chlamydia in the U.S., we're looking at about 1.5 million, and of gonorrhea, we're looking at about 400,000. Still, though, as you pointed out, with some of these, it's still on the increase. So gonorrhea cases have also increased about 13% since 2014. But we do test for these very similarly to chlamydia, actually using the same swab and the same urine sample. We can test for both.
And what are the symptoms of gonorrhea? Are they basically the same as chlamydia?
They're similar. Most people will have kind of a vaginal discharge, though. So you can have pelvic pain. Unfortunately, you can develop something called tubo-ovarian abscesses, which are basically pockets of infection in the pelvis. And then the discharge, and men and women both can have discharge with this.
Okay. And so, again, it's I just want to emphasize the importance of being, if you have symptoms, get in and see somebody because these are easily treated. Now, how do we protect ourselves from this, Dr. Stecker?
Well, wait, before we ask that question, can I ask one other question? Because we've been referring to everything by sort of clinical and technical terms, which I think is great because I think people should know proper terminology. But are there any other names that these diseases are known by that people would identify with more as opposed to the clinical term?
Isn't that what they know? That's a good.
Like when
we
we
don't banter around. Are you talking about like the clap?
Yes.
Honest to
that's
goodness,
what we're talking about.
Yeah, like
the clap.
that's. I mean, there are certain. There's.
I think that's from like World War II.
Well, I mean, some generational stuff. You know, like my son asked me the other day. He had he's doing the sex ed unit at school. He's a middle schooler. And they were referring to STDs, but then someone said venereal disease, and he got completely lost. Like, that's a different.
Do you know where that term comes from?
No.
Stecker, you know what that term is?
I don't.
This is interesting. I just found out about this like a week ago.
Oh.
And I think I knew it before, but I forgot it.
Yeah.
Venereal comes from Venus.
Oh.
The Greek god, Greek or Roman god.
Yeah.
Venus, the goddess of love, and venereal disease.
Wow.
How would you like to be the god of sexually transmitted infections?
No, that's okay.
No, I'll pass on that.
Yeah, I'm good right here. It's okay.
But it is interesting all the different. So I actually have some information about some of the slang terminology for these things. So for gonorrhea, you've got the clap.
Why do they call it the clap?
I don't know. Did you want to clap your legs shut?
Yay!
Well,
I
don't know if you even want to know this, but
I do.
It is a shortened form of the French term for brothel, clapier.
Oh.
And a primitive treatment that involved clapping the penis between your hands to squeeze out the pus. That is common.
Sorry.
That's
I'm
common.
sorry I asked. Now you have one more thing to worry about when you go see your doctor.
That's right.
Am I going to get stuck with a needle in my back, or are you going to have to clap my penis in between your hands?
I mean,
That will be the first and last time I see Dr. Stecker.
I'm really good at that.
Oh. That's going to be a little problematic. Just
we touch. We got to decide which one it is. It can't be two. It can't be clapier and...
It can too. Why can't it be?
Or it could be the drip. Apparently that's another name
drip.
for it.
Yeah.
The drip.
Well, I was thinking, is there any like modern terminology that we're missing here?
Oh, I got going on a tangent.
Keep going.
I got excited about it.
What else are there?
The dose is also something that we...
what?
The dose, D-O-S-E, because it can be cured with a single dose of antibiotics. So people refer to it as dose or dose, depending on...
Wow.
You got to be pretty
hip with the kiddos.
Hip with the parlance.
You got to be hip with the kiddos if you know that one.
You've had to have it more than 10 times, so you know.
Yeah, like where it's a regular thing.
Yes.
It's like, how'd you spend your weekend? I got a dose. Good. Yeah, no.
Oh my God.
Well, and then there's some stuff for chlamydia that I
Okay,
didn't
what is
know
that?
either. This is very fascinating. The clam.
The clam.
I have heard that.
Sport the clap.
I've heard young people call it that.
So, I guess that's the lingo because they call female genitals the clam.
Yeah.
I don't know if I've heard that one.
Oh, never mind. We won't talk about that here. I'll tell you off air. There's a phrase.
We probably didn't talk about it in Bible study.
No.
Nope, I'm a good Catholic schoolgirl. I don't know what you're talking about at all.
That's right.
So that's what I got for gonorrhea and chlamydia. I've got all kinds of stuff for the other ones when we get to them, though.
Oh, see? And honestly, the only reason I really brought that up is because I've noticed, and I'm having an interesting sort of engagement with this information now that I have younger kids in my family that are learning about it for the first time. So they're learning technical terms, but they're also hearing like their friends and their peers say other things, and they're mixing up sort of what is what or what constitutes, an STD, how you get an STD. And I think back in our radio days, we had many conversations about how kids don't think that sexual contact is the full range of sexual contact. They tend to think it's penis and vagina contact, and everything else is just messing around or not going all the way, which isn't accurate and can lead to diseases.
That's right.
So, I just was hoping to get a little sort of clarification in that if I hear kids referring to it, I can sort of catch it with my ear and go, that's still an STD.
So what are risk factors for these? And I guess this includes basically all sexually transmitted infections for the most part.
Yeah. So any new partner, people who have multiple partners. Unfortunately, homosexual men are more at risk for some of these transmissions. And if you're younger, so less than 25, we definitely want to screen more frequently for especially gonorrhea, chlamydia.
And my understanding is that over half the new infections involve people that are younger, that are teenagers and early 20s. And they are kind of hit the hardest.
Well, is there any merit to sort of these new sort of news things that are creeping up, talking about like how boomers are starting to become like are becoming an increasing part of the population of STDs?
Oh yeah,
Absolutely.
that's I don't know about you, Dr. Stecker,
but
but
C too.
Yeah, and it is because I think these people are now kind of emerging into their mature years and.
But they know they can't get pregnant.
They can't get pregnant. They can feel the abyss coming, and they're like,
I wasn't thinking of it that way.
No, but listen, I'm just saying that I'm there.
You can feel the abyss
coming. You can sense it. You can sense that life doesn't go on forever, and you're like.
Well, I mean, I feel like
do we need some counseling here?
I have talked to patients about. They're like, you know what? You only live once.
Well, yeah, but that's not like you feel the abyss. That's more of the like I earned it. I did all the right things. I towed the line. I walked the path they told me to walk. And in my golden years, I'm going to have as much fun as possible.
Listen, you feel when you get to be my age, you feel the cold, icy hands of death.
Oh, will you stop it?
Oh, wow.
Clapping on your penis. Did I just say that?
It's our own fault.
You did, and I don't.
It's our own fault for starting it.
And I'm speechless.
That was your fault.
It always is.
So how do we protect it? So, basically, multiple partners, new partners, partners in general, just,
use condoms.
Use
That's
condoms.
the number one best way to prevent these things.
Just half the time or some of the time?
Probably go with all the time if you can.
Okay, so if you have sex at 5 o'clock in the afternoon and then you have sex again at 5:30, do you use the same condom?
That would be preferable not to reuse.
Yeah, so you want to change the condoms.
No, that's important because somebody might be
important.
listening to this that doesn't really understand the mechanics of a condom because they've never really used them or they've not made it a regular practice. So you should at every sexual encounter, you should make sure that you're using a new condom.
Absolutely.
And is this true? My recollection is that latex condoms are much more effective than natural, like lambskin.
Absolutely.
So
don't use those.
And what do you?
Is there an alternative for somebody that might be allergic to latex? That's becoming an increasing thing.
Well, then
duct tape. You can make. If you go to the GynoCast website,
no, don't go to our
website. You can see
for
Dr.
that.
Heegaard's
I'm telling you right now.
duct tape.
I will not allow there to be a duct tape tutorial on our website. You can.
So, and that's a good point. And what do you? And there's other types of condoms that are not latex.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So what do you ladies, you two ladies here. So what does a woman say when they ask their partner to use a condom and they say, it just doesn't, it's not as enjoyable for me. I'm very sensitive and putting on a condom is just, it's not a satisfying experience
you want me
for
to be
me.
Honest?
For me, yeah, I want to know what because there are people. Listen, Twila, you don't believe this, but Stecker and I
believe it.
You people come in and they don't want to inconvenience their partner.
Right, women tend to want to be nice. We're nice to a fault. We want to be polite to a fault. We want to be kind to a fault, and we don't want to upset anybody. And
that's right.
And sometimes those situations are very fraught because it's not just about upsetting someone. It's about you're in a vulnerable position.
Yeah.
And you might be with someone who's physically bigger, stronger, more able to, to overpower you. So you do have to be thoughtful of that. My best advice is before you ever get into that position, you have very specific, open, frank talk about what is required of you. We're quick to tell a man that we require our doors to be opened when we go out. We require you to pay for a meal. We require you, I know many women who, when they're asked what their preferences are, they can come with all of those kinds of sort of genteel and
well, thank you, Miss Dane.
It's good
that you're still operating in the 18th century.
Oh, come
okay,
on. It's
listen
nice
here.
To have a little gentlemanly quality.
I'm very specific about this. I recently had a conversation about the idea of how much equality we want versus the things that are considered sort of social norms that we just enjoy. So. And in that respect, women are very easily, they can rattle off 15 things about a guy that they like or that they expect or that they want to have in the guy that they wind up with. But they can almost never tell you sexually what they want, how they want it, why it's important to them, or what their deal breakers are in terms of that. Yeah. And you have to be able to have that conversation fully clothed. If you cannot have that conversation fully clothed, you're going to have many, many more issues down the line beyond whether they will put on a condom or not. You have to be able to have that conversation. And the conversation does not have to be fraught or, upsetting. It can just be very much, we're heading this direction, because people have that discussion before they have the sex. They decide, we're okay, we've hit date number whatever, we've decided we're going to do this. Then here are my deal breakers. The deal breaker is you have to wear a condom. Yeah. You have to wear a condom. I don't want babies. You don't want babies. I don't want diseases. You don't want diseases. Yeah. Let's make this. If you're not comfortable with condoms, they make so many really great condoms that are like paper thin, but still do the job. Let's go figure out what those are, and we'll experiment till we figure it out. But you have to wear a condom. And if you happen to be in a situation where you are now in a vulnerable position, where you are naked and you're in that, like, the talking you into it moment, that moment can stop very easily. Get up and leave.
Or throw a condom at them.
Yeah, I mean, really, just say, listen, store's closed until that thing goes on. And if it's not, and there's still a discussion, there is a window where you can say, hold on, give me just a minute. Get up, go put said robe, clothing, whatever you need to go on. Go find the bathroom with the door that locks if that's what's necessary. Yeah. But you need to assert yourself and make sure that you're heard and listened to. There's really no middle on that, because it's your own health and your own safety that's at risk.
Well, I would like to interject, too, that brings up a very important topic, which is, and if you're in a situation, for example, where that doesn't work for whatever reason, and you do end up having sex with somebody unprotected, and you don't know this person or whatever, that's the perfect opportunity. You should get in and see your gynecologist and get tested, because as Dr. Stecker was saying, many of these sexually transmitted infections have no symptoms and yet can have significant long-term repercussions on just, for example, pain and infertility. And so don't wait for something to happen. Correct?
Correct. And also come see us for emergency contraception too.
Yep.
If you're in a situation like that, you can certainly come and see us, and we can talk you through that.
That's right. And we have heard it all.
We have. Nothing surprises us.
That's right.
And just kind of to piggyback off of that, there's this new thing called stealthing that's kind of...
Yes, thank you for bringing that up.
And
it's terrifying to me.
It just definitely brought that up.
It's like the vilest...
Yeah, I agree. I think that's incredibly... But see, and honestly, that's one of those things where it's even more important to be sort of demonstrative and know your body and be comfortable with your body sexually, because that's such a vile thing for somebody to do, and it sucks that now we're in this territory where we have to teach women to sort of like teach themselves to check during the process. Yes. But you may have to do that. You may have to know how to do that. You may have to know the difference between, really know your body well enough to know the difference between when you can feel that you're wearing a condom is being used and it's not being used. And that might just be, you knowing from the touch of your hand in the slightest fashion that, something's wrong here. But you have to sort of be able to advocate for yourself. And it's, like I said, I'm beyond disgusted by that. When the first time I heard it, and I said, wait, that's not a crime. There's not a law. There's not.
Well, there might be soon. But stealthing, just for those of you who do not know, is when a guy will start off wearing a condom and then he'll take it off.
During the sex act. So that you're not aware until it's done. Which is, I'm telling you.
Yeah.
Listen, I say all the time, I'm I really appreciate that I'm not out here in these streets trying to date now.
You're not a gal on the street anymore.
No, because I would just, I'm not a woman on the street, thank goodness. But I just don't. It's so complicated now. And the lengths people will go to, it's so complicated now. Why can't we just be decent people? It just drives me nuts.
That's a good question.
Why indeed? So the other thing I want to bring up too that adds another aspect of this is that we have seen in recent years that there's becoming more drug-resistant types of these sexually transmitted, including gonorrhea. So
absolutely,
another reason to
you mean like superbugs?
Superbugs, seriously.
That's just what we needed. Superbug STD.
And so get tested, protect yourself because most of the time these things can be treated and managed, but it's becoming more complicated in certain situations. So let's talk about trichomonas. That's something.
Does that have a street name? Because I've never heard of trichomonas ever.
That is a great
well,
question.
I think they call it the tricky trick.
I don't think they do.
Do they
that.
really?
No, I just came up with that. I don't.
He
The padunkadunk.
He sounds like my 13-year-old making up.
I
stuff.
don't know. That is another. The trichomonas is another condition that. Stecker, are you okay?
No, the tricky trick. I'm very excited about that.
But this is another thing. I think. Let me just throw out another truism. If someone is having drainage from their penis, don't have sex with them.
That is a very good point.
Or a
Throw it out
lesion,
there.
like an ulcerative lesion. Just if they have a sore anywhere,
if it doesn't look right, don't do it.
just stick with emotional intimacy, right, Stecker?
I 100% agree. Emotional intimacy is sometimes better than physical intimacy.
Yeah. And what did you say, Twila? You've said this before. We in our old days.
Yes.
On the we had a sex therapist that said something very profound.
I love it. If you can't have these conversations outside of the bedroom, you shouldn't be doing anything inside of the bedroom.
There you go. You heard it here.
There you go.
But the main complaint of trichomonas is, of course, discharge, and that is an uncomfortable discharge too. Correct?
Mm-hmm. It often can be. So you get kind of some itching and burning with that discharge.
And so you would hope that that's something that would bring people in to see their provider. But again, that's something that's very common. And like many of these things, many of these conditions, men seem to get away with a lot.
They do. I mean, in every aspect of life, but yes.
They do. And, but they tend to be like chlamydia. They can have a discharge, or gonorrhea. They can have a discharge, but a lot of times it's not as bad or as bothersome, especially if you clap your penis every day.
I'm just saying.
I'll tell you what I tell my friends is clap your penis every day. And back in World War II...
Not
back in WW2, we used to just say,
boy.
clap yourself.
Wow.
Oh, my Lord.
Anyway, but unfortunately, men don't get away scot-free with trichomonas. So they often will have burning and pain after ejaculation with this. Yeah. So they will have symptoms.
And so, get in and get treated. For the guys, too, obviously.
Absolutely.
And so, which one do you want to go to next? Syphilis?
Let's do HSV. Herpes.
Okay.
I think that one's important because so many people get weirded out over the idea of it, and it's so much more common than people realize.
Well, I'm going to ask you. Let's just touch on syphilis for a second, because the reason I want to do it is it's treatable.
That's true. It is.
And
treatable.
so it's easily treatable if you recognize it early. And so the symptoms of syphilis really in the early stages are ulcers, raw ulcers on the genital area. And so, again, I think that we can all agree on this. If you have a partner and you see them naked and they've got an ulcer is like a raw area of skin in the genital area, I think I would hold off.
I think that's a good call.
Well, you know what, though? But you say that, and I think that's really important because I am in an age range where if I was newly involved with a new sexual partner, there comes a point where unless you're like, the most workout fanatical person there is, where you have sort of middle-aged...
I'm waiting to see where this is going.
well, as middle-aged folks tend to like to do things with the lights off, so you're not paying attention to everything.
I
Young people
that.
show off. We're a bunch of show-offs when we're 20. When you're 20 and it's never going to get any higher or any tighter, you'll do somersaults naked. But when you're 40 and you're divorced or you've had kids or whatever, Oh, you're missing out in life. Sorry.
But I mean, go home and do that later.
Oh, my rotator cuff. Oh, my back. My plantar fascia.
Well,
But I mean, that's an important part. Like if one of the signals is to be physically looking for something that looks unusual, and you're having sex essentially in the dark or in a very darkened space, you're not going to see these things.
that is
So
true.
what's
If
your-
you're not performing oral sex, you might not see these things
Yeah.
because a
Well-
lot of people don't do that.
And syphilis, the lesion's actually painless.
Yep.
So, you don't have a lot of symptoms with that.
That's
So unless
right.
you're down there with your smartphone flashlight, and you're like, hold on, let me check. You're not.
But
you might
syphilis,
see-
this is actually, syphilis is another sexually transmitted infection that has gone up significantly in the last decade, and it used to be very rare, but it is something that if you don't, and they talk
Well-
about historically, and syphilis causes, in its most extreme form, can cause dementia. I mean, they called it neurosyphilis, and you can get a rash, which is not the worst thing in the world. But
Well, why would that? Why is that? Why is that taking such a big jump? Why? What would lead to that?
I think it's I would imagine it's the same thing you were talking about, Dr.
Combination
Stecker,
of
which is
long-term birth control and people not being careful.
yeah.
Okay.
And because it's important to be able to recognize this stuff early. All right, now, Dr. Stecker, we can get to what you want to talk about, which is herpes, which is another one of these things that I will tell you. I'm old enough. Twila, you're so young, you probably don't remember this. But I will tell you that
I'll take it.
In 1982, when I was graduating from high school, there was a Time magazine article that had on it herpes, and it was all in red, and it was implying that this was the scarlet letter, basically, that herpes was the worst thing in the world. And the interesting thing was that about 2 months later, HIV kind of came on.
Oh wow.
In terms of prominence in the media, and herpes is one of these things that is so prevalent. And again, I think I don't want to minimize the impact of herpes, but it causes symptoms, but for the most part, doesn't really cause any long-term issues. So why don't you describe what is herpes and what sort of symptoms does it produce?
So the CDC estimates that about 776,000 people in the U.S. get a new herpes infection annually. So it's a very good amount of people. And there's two different types of herpes viruses. There's herpes simplex virus 1 and 2. And we typically associate herpes simplex 1 with the oral lesion, so cold sores.
Yeah.
And we typically associate HSV2 with the genital lesions. However, if you're having oral sex with someone who has HSV1, you can transmit that to the genitals. And it is true that it's mostly just uncomfortable and things like that. It doesn't do reproductive long-term issues. However, it's very important to know that when you're pregnant, because we prevent you from getting outbreaks when you're pregnant, and you can unfortunately transmit that to a baby at delivery if you are having an outbreak. So it is important for reproduction on that side of things, but it is a virus.
So what do people present with? What are the symptoms that they may have if they have a herpes infection?
Yep. So for the primary herpes outbreaks, it's typically pretty significant. And so people will have pain and they'll have little ulcerations. And usually people are very uncomfortable.
And the ulcerations are, they're for the most part, they're virtually all, at least in the genital type, they're all in the genital area. And this is one of the things that if you use a condom, which we recommend all the time, unfortunately, this is a situation where if somebody has an ulcer elsewhere than, in the penile shaft or on the end of the penis, and you can still be infected.
Unfortunately.
And so, what tends to happen in terms of, if a person gets infected by this, what is the long-term implications?
Mm-hmm. So basically with this, you can have recurrent outbreaks, unfortunately. So you typically have a primary outbreak, which can be the most uncomfortable one. And then you come and see us and we treat you. And then everyone has a different course. So some people will get more frequent outbreaks. Some people will, only have one or two in their lifetime. And for people who have more frequent outbreaks, we typically will put them on medication to prevent them from getting outbreaks. So we'll prophylax that.
And so the oral type of herpes, and people also will call those cold sores.
Mm-hmm.
Now, just since you've got this information, is there another term for herpes? We talked about the clap. We talked about the dose. We talked about the drip. Is that?
Yep.
Uh-huh.
Hold on. I'm pretty sure that there is. So, fever blisters.
Yeah, I've heard that.
And the gift that keeps on giving.
Stecker.
There you go. The gift
there you
that
go.
keeps on giving.
Well, it's interesting because you had mentioned that herpes, or you've got the oral herpes and the genital type. But I don't know about you, Dr. Stecker, but I have seen some of the most horrible herpes infections in the genital area from oral herpes. It's like, I had a couple one time where the woman came in and she had a very, very painful and pretty extensive herpes outbreak, and she was looking at her husband like she wanted to dismember him, and he looked like he wanted to run out of the room. Although he looked very innocent and sort of shocked, and so I went ahead and cultured it, which is, and you can diagnose these in a couple different ways, which I want to talk about in a second. But I cultured it, and it indeed came back as type 1 or oral type herpes. And so they'd gone on vacation and without the kids, and engaged in a wide spectrum of intimate activities. And so he had a cold sore in his mouth, and that passed. And so you can't make those judgment calls all the time. And the good thing is that oftentimes the recurrences, if you're going to have a recurrence, tend to be less severe than the first one. Now, how do you test for herpes?
So, like you said, we can do a culture, or we can do it with blood testing.
Okay.
And look for antibodies.
And so, how does that change the way we manage these conditions?
Well, it's important to know what you're dealing with. So if you have an ulcer somewhere in the vagina, the cervix, the vulva, it's good to know exactly what kind of ulcer you have so that we're giving you the right treatment.
Okay. And so, one of the other things I just wanted to say is, I don't know if you get these questions from patients sometimes, but they say, what do I tell a new partner? I'm in a new relationship and I have been told I have herpes, even though, many women can have, and men, of course, too, but they can have a herpes outbreak, and they may never have an outbreak again, ever. Or they may have an outbreak every 6 months. And so, I've had people come in and say they just feel, literally, they say they feel filthy. That I've been exposed to this and I have this condition. How do you counsel your patients on this?
Well, unfortunately, even condoms don't 100% prevent it. However, it's also important to note that you don't have to have symptoms or these ulcers to spread it either. So you can have this non-asymptomatic viral shedding is what we call it. And so you can transmit this virus even without symptoms. And so for people who've got these outbreaks, putting them on medication can help prevent them from spreading it and prevent them from getting the ulcers. So doing that is a helpful thing. I think the number one thing is you have to be honest with your partner, because certainly no one wants to be surprised by anything.
Right.
And using condoms and taking medication are the best ways you can prevent your partner from getting it.
Because this is one of these sexually transmitted infections that does not go away.
Right.
And if you've got herpes, we don't have a cure for it yet, but it can go into remission. And so it's one of those uncomfortable conversations you have to have with a new partner.
But please have that conversation. Be honest with your partner. Don't think I don't have symptoms or I haven't had a breakout in a long time. I just won't say anything unless I have to. I always tell people, think about if you were in that position and someone withheld information from you, how would you feel?
Absolutely.
So be honest with your partner or any potential partner.
And you can only be as honest as you have information for. And I've had people again where they say, well, my boyfriend or my girlfriend left me because they found out I had herpes. I just feel like, let that person go, because they are idiots. And frankly, they're idiots if they leave a relationship that is otherwise fabulous because they found out that their partner has herpes or HPV for them. And we're going to talk about that on a separate show, because that's, that is actually the most prevalent sexually transmitted infection. But, I just like to echo what you said, Twila. It's important to be honest. But people their partners need to be educated about this stuff.
Absolutely.
So, and let's, you had mentioned that, and just for partners education as well, is that, if you have a partner, for example, if you don't have herpes and you have a partner who does, we can really minimize, if almost, eliminate the chance that you will get it by putting the partner on
medication,
suppressive medication. And so, don't lose hope in terms of if you do have this condition.
Absolutely.
All right. Well, there are there are a number of less common sexually transmitted infections, and we, I think that could be another show. But things like hepatitis B, hepatitis C, and HIV, of course. But those are kind of specific examples that I think we should talk about another time. So, Dr. Stecker, thank you so much for joining us.
Oh, thank you for having me.
Indeed. And don't forget, if you have comments, you have questions, you want to know more about the topics, you want to let us know what you're thinking about the show, you should get in touch with us. Go to Facebook. If you go into the search bar, you can type in the Gynocast. You should already be a member, but if you're not, just ask to be a member. Hit the button, and we will review it. I promise you, review is easy. It's basically just making sure you're not trying to solicit us or be inappropriate in this group, and we'll let you in. We have conversations that extend beyond our show. We continue topics. We suggest topics. It's a really great, thriving community of conversation, and it's a very respectful conversation about topics that can be sometimes difficult to discuss.
That's right.
So we want to make sure that if you're in there, that you want to be in there, and that you're able to engage in the discussions fully, just like everybody else. You also have the option, if you hit the send message bar, to send us a message. You can ask your questions, you can make comments, and let us know more about what you're thinking and what you think of the Gynocast as well.
And beyond and you're talking about some of the serious, wonderful aspects of the Gynocast Facebook group, but I want to just say it is a world of wonder. The Gynocast is just a place that is. I'm trying to. I don't even know how to explain. It's so life changing.
You like to say it's life changing. You haven't said that, and you haven't said I was a shell of a person for a while. You might go for it.
Well, Twila was a shadow of herself until she joined the Gynocast Facebook group, and now look at you. You're a
vibrant.
You're vibrant.
Woman on the street.
Woman on the street.
You're vibrant. You're the vibrant gal on the street.
That's going to be the thing that winds up on the T-shirt. Woman on the street, right there.
All right. Well, thanks for listening, and we will see you soon.
Thank you so much.